Good morning, everyone, and welcome to today's segment of Family Law Uncorked. I am Jen Bordeaux, the Director of Public Relations with New Direction Family Law. And as your friendly reminder, today is Wednesday, April the 29th. I look at that every time before I go live with these, and I still have to look at it again whenever I'm about to say it to make sure that I'm saying the right date. But thank you for joining me again today. And I have a very special guest today. His name is Mr. Lewis Finch. The man, the myth, the legend is joining us today to talk about the amazing and important work that he does for a particular population in our community. And so I look forward to getting more into that. And before we get into your company, and you've got a few, you're a busy man, we wanted to shed a little bit of light on the topic of substance use and abuse in general, but especially how it may be affected during this particular public health crisis, because the effects of COVID-19, coronavirus, the Rona, whatever you want to call it, are very far reaching. And those that are struggling or have a history with substance abuse are no exception to that, and their families. So we definitely want to shed light on all of that and talk about resources and what sort of issues people might be facing in addition to normal things that go along with that. So Lewis, first of all, thank you so much for joining me this morning. And if we can start off by just, if you don't mind, just introducing yourself and telling us a little bit about you and Welwynn.
Well, thank you. Thank you for having me. Yeah, I am Lewis Finch. I am the founder and CEO of Welwynn Outpatient Center. We are an addiction treatment center serving executives, professionals, and their families. And the story of Welwynn really comes from my own personal story. So you asked me about my background. I was born and raised in Raleigh. There are very few of us left, as you know.
Rare breed you are.
We are, very much so. I grew up in a very middle-class family. We lived on St. Mary Street. I went to public school up until the age of 16 at all the local schools. There was no indication, well, at least except upon reflection, that there would ever be any issues with me and addiction. But I've got a brother and a sister. I had two very good, loving parents. Had a great family upbringing. And part of my issue started. It was interesting. I've done a historical. So just so you know, I am in recovery. Have been for over 13 years. And it's interesting when I got into it. I ended up doing a historical look at my past, and my issues really sprang up when I was 13 years old. I actually started drinking at 13. So, and I ended up getting sober at 51. So I had a 38-year drinking career. There were other things involved as well, but alcohol was pretty much my base drug. But again, you don't start out at 13 as you end up at 51. At least you hope you don't. But it was a fairly consistent pattern of behavior. So I had, again, from age 0 to 13, things were fairly normal. 13, I actually got with another guy who ended up being an alcoholic as well. And he and I were friends, and we just started testing the waters, and we both liked the feeling that alcohol gave us. Again, we didn't get obliterated. There were no consequences at that point. But you could tell, at least I could tell at that point, where this was, how this made me feel, the feelings behind the addiction. And again, addiction is really a symptom of an underlying condition. And I've come to understand that. My drinking and there were drugs involved. My drinking and drug taking made me feel different, or made me not feel. It gave me and I think after having worked with alcoholics and addicts over the last few years, I've come to realize that yes, getting the drug and the drink out of the person is important, but it's equally as important to understand why they do it and to have them work on that part so they don't go down that path. So, like I said, I started at 13. Things were going pretty well until I reached the age of 16. And at some point, when I actually went off to high school, and back then high school was 10th and 11th and 12th grade. 10th grade, the wheels fell off. It was so bad that my parents ended up shipping me off in my junior and senior year to a private school in Virginia because they just simply did not want to deal with me. It probably saved my life. I graduated from high school, not with honors, as most people would say, but I graduated and I actually got into virtually every school I applied to for college. Which I mean, I don't think I ever would have gone given the direction I was going.
Sure.
I ended up going off to college, and all college really did for me from an addiction perspective was to help amp that up, because now I was free. I had no parental controls on me or no authoritative controls. I was living on my own. I actually lived off campus. The entire time I was in college, I lived off campus. I never lived at home, never lived in a dorm. And it was basically a free for all. It took me 5 years to graduate, but the first year you can almost not even count it. It was just one giant party after another. My first year in college. So in my second or third year, I met a young lady who eventually became my wife of 30 plus years, Janie. And it's interesting because I reflect back on that time. And she and I really had a great time, particularly in college. And she could stand toe to toe with me drinking. It was a very symbiotic relationship between us. But at some point during our relationship, she jumped off that train. And what I have found in talking with couples, particularly, that they start out in a situation very similar to mine, where both parties are attuned to doing drinking and partying, whatever you want to call it. And then one of them becomes a responsible adult. I never became that adult. I was functioning. I would go to work. I had a very successful career. I mean, I have to make a list of this. I went to work right out of college for my family's newspaper up in Henderson. I had jobs from, by the way, I'm a 64-year-old, so bear with me. My dates are, but I went to college in 79. I graduated I went to college in 74, graduated in 79, and worked from 79 till 88, I believe. And I had several jobs in the advertising and marketing world, which, by the way, was my life up until Welwynn. After that, I became what I now know to be as a serial entrepreneur. I actually bought into an advertising agency in the late 80s, became a part owner in that. And in 91, I actually bought the owner out and formed what at the time was the Finch agency. It was a full-blown marketing agency. This is prior to social media. So it was all print, TV, radio, outdoor, that kind of stuff. And I grew that. And along the way, I also owned a bar and a restaurant, which is a great thing to own if you're an alcoholic, let me tell you. You know, so I had a bar and a restaurant at the same time we had the ad agency. I then took on a couple of partners in the mid 90s. We built the ad agency up and then we also added onto the ad agency, we added a production company and a secret shopping company. So it was a multiple businesses within a business there. And in 2006, I ended up, we ended up selling it to a holding company for a lot of money. At the time we did this, my addiction was off the charts. That's why I bring this story up. There's actually an event that I don't discuss very much because I forget about it. In 2004, I ended up having a gastric bypass. And for those that are listening to this or saying this, that have ever experienced that, In first place, at the time I weighed 300 pounds or close to it. I'm now under 200. So you end up losing an enormous amount of weight in a very short period of time. I lost 100 pounds in 90 days. And if you do drink, the alcohol affects you entirely differently. So after my surgery, I started drinking probably 6 months afterwards, maybe not that long, but somewhere afterwards. And I immediately noticed that the feeling I got from drinking was intensified and it was immediate. So I would take one sip of a drink and I would feel it in my head. And I like that feeling. The different, what I have come to find out from addicts and alcoholics is that the euphoric feeling that we get is in your mind, in the non-alcoholic's mind, is a time for pause. My wife is a great example of this. I ended up, so she can have one, maybe two glasses of wine and she's done for the night. When she gets that feeling of almost being out of control, she shuts it off. And with me and most other alcoholics, that's our license to just step on the gas pedal. So I was drinking, and actually after I had my surgery, I was blacking out every single time I drank. And I did that from 2004, basically the summer of 2004 to the spring of 2007. There were incidents along the way. I never lost any jobs. I don't think I destroyed any friendships. The family life wasn't what it should have been, but Janie and I were still together. And but what ended up happening was there were a series of events, and this is usually what happens in most alcoholics and addicts' lives, that there are consequences. I got 2 DWIs. You know what those are, right, Jim? I mean, you guys in your world, okay. So I got 2 DWIs in 90 days. I got one in January and one in April of 2007, and my life changed dramatically. At the time, that's what caught my attention. Those were my consequences. I ended up going away for 34 days to a treatment center in Georgia. I came back, and I did not drive a car for over 3.5 years.
Wow.
Yes. And then for the next 3+ years, I could only drive one car on the planet that had that little blowing device in it. And at the time, I was the CEO of a fairly large advertising agency. And you've got to know that the blow to your ego at that point is astronomical. Fortunately for me, I had gotten into recovery, because after all that happened, and I'd had a fairly idyllic life, my life fell apart. I ended up losing my father, my wife, and my mother in the next 3 years, back to back to back trauma. And I didn't drink, which is even more amazing. So if that kind of gives you a little perspective into what I have gone through / put myself through, I hope that kind of lays the foundation. So from that area, after my wife passed away, I ended up retiring several years later, maybe 3 years later. And my brain was like mush at this point. I'm still not drinking or doing anything else, but my brain was like mush because I had not processed my grief. So when I retired, I moved up to Lake Gaston in a double wide mobile home right on the lake, and just sat there and just pondered what life had to offer me. At some point during that continuum, I ended up having a treatment center reach out to me, asking me to come on board and be their marketing director. I took the job, which I hadn't had in 30 years. I hadn't had a job in 30 years. I'd always worked for myself. And I learned the business model of addiction treatment from the inside out. I actually was part of the admissions program too. So I got to see virtually everybody who came into the program, talk to the families, and to see firsthand just exactly what alcoholics and addicts put their families through and what the process of recovery looks like. And other than little bumps along the road, life has been pretty good after all that. But it took me going through all that at, pretty much through the age of 57, 58, 64 now, maybe been even 60. But it's very, from a personal standpoint, all of that, upon reflection, really did bring me to this path. So when I'm down at the treatment center, I put together this business plan based on what I thought addiction could look like, addiction treatment could look like in an outpatient setting, one that would address alcoholics and addicts that were professionals. Because when I was in treatment, I was in there with 18-year-old meth and heroin addicts, and not that we're not going through the same thing, but we just don't have a whole lot in common. Mm-hmm. And I felt like if you could bring peers together that were to somewhat higher functioning, like professionals seem to be, that it would give them a better platform for developing their recovery. And that's where Welwynn's whole business plan came from. We treat anybody who is a licensed professional, think doctors, lawyers, pilots, anyone, financial advisors, anybody who, if they lost their license, would have a difficult time with putting bread on the table. And then, of course, entrepreneurs, business owners, high-ranking executives in some of the largest companies in the Triangle, folks that would like to get help, but in a setting of their peers. That's what it basically is, a glorified shrine to me. If I could have gone to outpatient, this is where I would go. And at the time, as a CEO of a company, you're really not ready to give up all the trappings that come with that, because your ego is still inflated. And not that mine isn't, but it's much more in check than it ever has been. And to run a really good recovery program, you have got to get out of your ego at least part of the time.
Well, first of all, thank you for sharing your journey and your experience. I mean, I know that you probably, switching from going through it personally and then professionally now is what you do too. It's constantly a part of you, but I love that you turned it into a way to help others. You saw kind of a gap, through your own experience, and have turned it into a way to kind of fill that gap and help others similar to yourselves. And one thing that I love about Welwynn too is that because we've known you guys for a few years now, and if there is someone that a family member or the user that we send your way or something, or that anyone sends your way, and maybe it's not a good fit for Welwynn, you guys help find the right fit for them. I can't count the number of times I've reached out to you guys, and it's been, one of the other members there at Welwynn is, on a plane to, somewhere helping someone, get treatment and everything. So thank you for the very necessary work that you do, and again, for sharing your journey. Switching focus a little bit to now, what we've got going on, because we could talk for days about addiction, substance use, and all the different factors that play into that, family relationships, all that kind of stuff. But focusing a little bit more on our current state of affairs in the world, this brings in a new element of things, to be on the lookout for, or stressors or triggers. And so we actually, Elizabeth tuned in and said, "Hi, Lewis." And she had the question of, and I think this is a great question, of how can we support friends or family that are struggling during this time with relapse? So maybe if they've gotten help, they've been in recovery, but with the different mental and emotional triggers that are going on, that we're all trying to navigate right now, I can definitely see how that would be an increased risk for triggering for relapse. So what can we do as friends or family members to help support those particular individuals?
So let me kind of digress a tad, because what we're witnessing right now is like the perfect storm for breeding alcoholics and addicts. When we do, as you pointed out, we service everybody who comes in. Anyone who comes to Welwynn gets placed, if they're willing to go, where they best fit. whether they're fit for us or not, it doesn't matter. Most people who come into us either need to go to detox first or go to residential treatment first. So we're not even the first stop along the way. But what we have found over the years is that when we hear someone and they're drinking or doing their drug of choice in the basement, in the attic, or if they're alone, they're isolating, which is exactly what's going on right now with the shelter in place that we're going through. We know that the end is near. So we've been anticipating a surge in people popping up wanting help from day one. This is a fertile breeding ground for addiction, the isolation we're all going through. So given that, and the fact that a lot of family members are now at home with their loved ones, and up to this point, they probably have noticed signs, but they really weren't sure, because alcoholics and addicts are great. I say that alcoholics and addicts do three things better than family members ever think we can do it. We minimize our condition, we lie to ourselves and to our family, and we manipulate everyone around us. And we're great at hiding our disease. So now that it's getting difficult for a lot of these people to hide their disease, their family members are going, wow, I didn't realize it was that bad. I knew we were going to have a problem. But what do I do? So the short answer here is, if the family member, first of all, I think I pointed out in my story that I never got help unless there were consequences. So the family, if they really want this person to get help, has to amp up the consequences. They have to start the process. Simply begging me to stop drinking did not work. My wife did it for years, didn't work, didn't care. There had to be consequences along the way. So the family has to interject the consequence, and the consequence can be as easy as, I've set up an appointment with you to talk to a therapist. My suggestion would be to reach out, if you know someone who's an addiction therapist, and there's a difference. A lot of therapists are great therapists, but they're not expertise in addiction. You certainly can call me and my staff, and we can, as we've already discussed, we can kind of ferret out as we get the calls to people that we know in the recovery world, therapists that are good. But I would start that with that. Even if your significant other does not want the help, you need help. We often said when I was working for the residential program that in most cases, the family was sick, it was as sick, if not sicker, than the individual they were bringing into treatment. Because remember, they're not going through this other than seeing what's happening. They're not alcoholics and addicts necessarily. And their world is now being rocked because they're seeing firsthand what's going on. I mean, if someone's really good at hiding something, they're going to hide it, particularly if they are an addict or alcoholic, because unfortunately, our first love is the drug or the drink. It isn't necessarily our family members. Do we love them? Absolutely. But that is our go-to. So to answer, that's a long-winded answer, but the family members that notice that have got to ask for help, and they need to do it to find someone who is clinically trained, or at least like me, that has gone through this and knows what's coming next, because I can predict with a fairly good degree of certainty what is next going to happen once this is amped up. And we, or whoever they reach out to, can probably help monitor the situation, or at least give them talking points. And with the ultimate of getting them to actually speak with a therapist to determine where they are in the continuum of addiction.
Okay. And so, I mean, and I think, I will just say, I mean, using you guys being a resource for appropriate therapists, that specialize or focus on addiction treatment is great. We have met at New Direction, we have met so many great therapists thanks to you guys. And then earlier you also mentioned that drinking and drug use stems from an underlying issue, that there is a why. It's not just for fun. There is a why. And so I love that piece of reaching out and helping them get help and speak with a therapist, as well as the family member who's dealing with this as well. Because there is a why, and whatever the underlying issue is, they likely don't even recognize it. I would venture to say. And now during this time, we're adding these new feelings and these new stages of, feeling kind of depressed and lonely one day, and then you're okay the next day, and then being hard on yourself. Well, I didn't really do much today. Is that okay? So with that being said, I will say we have a family law in court coming up. I believe it's next week with Tina from Simply Thrive that you guys introduced us to. And we're going to be talking about how important it is to take care of your mental health now more than ever. I mean, always, but definitely during this time as well. So I love that piece. Another part of this that I want to focus on, which kind of ropes you back into this too with your story, that I didn't even think about until you and I chatted about it, was risks around someone who is in recovery or is currently struggling with addiction, that tests positive for COVID-19 and finds himself in the hospital for treatment and everything around that. So you gave me the okay that yes, you did test positive for COVID-19, and it was unlike anything you had experienced before, and you were in the hospital, but there were risks around that given your, being in recovery and your history. So can you speak a little bit to that? Because I think that's something not a lot of people have thought about.
Well, yeah. As to your point, I tested positive a while ago, and ended up developing symptoms of fever, body ache, and eventually the breathing issue, which eventually that's what actually led me to go to the hospital. I was in the hospital for almost 3.5 days. I was never on a ventilator. I never felt like my life was in danger. But I will tell you, having had pneumonia and bad colds and flu and all that stuff, it was nothing comparable I've ever had that replicated that feeling. You and I could not have had this conversation 4 weeks ago. It just wouldn't have happened 3 weeks ago. Every breath I took was very labored, and any movement I made. So in the hospital, and I told them up front that I was in recovery and that I didn't want to take any meds. Luckily, I didn't have a whole lot of problems sleeping because they were asking me was I anxious or whatever. So I was offered, prazolam, which is Xanax. I'm trying to think. Oh, I did take trazodone, which is a non-narcotic. But those of us in recovery have got, if we're going to be true to our word, we've got to be vigilant. And I had to lay my cards on the table when I was in there, and they understood that. I will say this, however, so they have to treat the immediate need. So if there had been a need to give me something that ordinarily I wouldn't have taken, I wouldn't have hesitated to take it. Because if it had been a question of saving my life, yes. But knowing that and being aware of the fact of who I am, I had to weigh all of that if it were to come up. But those of us in recovery face that all the time.
Yeah. Like I said, I hadn't even thought about that until you mentioned it as another piece to this. So once again, thank you for sharing your story.
I got a clean bill of health. I can actually roam about the country if wanted. I'm staying home. My wife did not get it. And to my knowledge, no one has contracted it from me since then. In fact, myself and one other person, only people I know that have gotten this thing. So if you can avoid it at all, please do so.
Yeah, absolutely. I know it's all struggle sometimes staying in the house, and we obviously we're all ready to get back out into the world, but it's a real thing. It's sometimes we don't feel like it's real because it's not affecting us directly, but that is clearly not the case. So I don't want to take up too much of your time, and we can get moving on with the day, but going on, people getting in contact with you guys now. I mean, obviously you're a great resource to field a person's need, put them in contact with a therapist or a treatment facility. So what are operations like right now with the, businesses being closed and social distancing and everything? Are you guys still operational? Are other treatment facilities still operational as far as your resources for getting people assistance and help?
Well, so I spend the bulk of my time on the phone talking to local therapists, treatment providers all around the country, particularly residential programs, and also local providers in this space as well. And I got to say, this is a big shout out to all those guys. To my knowledge, I have heard of one incident where one treatment center actually had a patient that tested positive for the virus. I think that the industry, my point is, I think the industry as a whole is doing an excellent job of treating people, particularly if you're a residential program. You can't avoid not going into that program if you're in it. In our case, about a month ago, maybe longer, time kind of flies when you're having this kind of fun, right? Sitting at home. We maybe in the middle of March, heck, I can't remember. We ended up shutting the facility down, the physical facility down, and then running everything off of a virtual platform like Zoom. And we haven't missed a beat. In fact, a lot of our folks really like the format. It does present some issues, particularly if you're running groups, and our groups last for 3 hours, and they're 3 days a week. And you're staring at a screen. You know this because you've been on multiples of these. Can you imagine staring at a screen for 3 hours? And how at some point you just, and you can walk away and do all that kind of stuff. But we do groups, we do individual sessions, we do some family sessions. We even do some couples counseling as it pertains to the person and their family. My understanding is that the individual therapists are doing the same thing, have been doing it for a while. And we really haven't missed a beat. It's interesting. I was talking with a treatment provider yesterday, and what I'm hearing from the community is that the call volume is down. So not as many people are reaching out, which I find, well, it's probably because it's very difficult for the family member to call while the other person's in the room with them. But the calls we are getting, the people that are calling are much more motivated to get help. Evidently, the pressure's been amped up at home, and the problems are coming to the surface, and they're now ready to act on them, or at least they think they are. We haven't missed a beat. We constantly stay in touch. In fact, we're probably communicating with our folks more so now than we were before, simply because they are as lonely as we are at home. And we do constant check-ins with our folks to make sure everything is okay. And when things aren't okay, and that does happen from time to time. But the objective here is to keep them on the straight and narrow until we can get back to some kind of normalcy. And as you're seeing, you're seeing, I don't know if you saw this or not, but I think as a week or so ago, alcohol sales in the US are up 55%. 55%. And that's going to create a dynamic. I don't care what you're talking about. It's just going to lead for folks like me, for the 13 to 15% of the population that are predisposed to addiction. It's just going to create a problem that we're going to be servicing for quite a long time.
Yeah.
But to get back to the original question, you can go on the Welwynn website, welwynn.com, and if you call, you'll either get me or Mike Yarborough, our president and chief operations officer. We answer all the calls after hours, and now that we're going through all this, and we will take care of whatever placement is needed, directing people. We refer to it as treatment navigation, because to me, that's the key. We look on it as we have a legal and ethical obligation to give the person who reaches out to us the best level of care that they can afford and that they need. And we've done that from day one.
That's awesome. I guess the biggest thing that I would want people to take away from this is that, you know, under normal circumstances, it can be very trying times. And so under this new normal we've got, however temporary it may or may not be, there's still resources. Everyone I think that is in that field and numerous others are doing everything they can to still make sure that they are providing that outreach and that care, and you know, and that assistance in helping people. I think that's one great silver lining thing that has come from this, is that the way that across the world people have come together to reach out and show support, and the work that you guys do is no different. And so thank you for still being such an amazing resource. And I hope, you know, someone who needs it, or multiple people that needs it, sees this, and whether it's a family member that is helping someone in their life with addiction, or someone who is struggling with addiction, that they know that they have a resource, and you guys do everything you can to get them in contact with the right good fit to get them where they need to be and get them on the path to recovery. So anything else before we wrap up here? Anything else? Any closing thoughts or positive words or anything you want to say?
Good question. I will tell you that I'm not immune to the feelings that everybody's going through. So when this thing first started, it was about the time that I started developing symptoms. And I went through a tremendous amount of anxiety, because they're going to be people out, and you already started saying, they're going to be people out there losing their jobs. You can see families struggling. You've got to ask for help. The problem with most alcoholics and addicts is they don't ask for help. And families are the same way. The first step in this entire process is reaching out and asking for help. You may not like the answer, but that's where it begins. The healing begins in the very first ask. So I would encourage anybody who has any issue at all, or knows someone that has an issue, to at least reach out, if not to us, to someone that they trust that can get them the help they need.
Absolutely. Absolutely. Well, I'm so glad to hear that you have recovered from COVID. I think you were the first person that actually knew that tested positive. I'm glad that there hasn't been more, but so I'm glad to hear that you are feeling much better, and you know, can walk around and breathe, and you're pretty much back to 100%. So again, thank you so much for dedicating some of your time to myself and the firm today, and to those watching as a resource in the community. And stay safe, stay well, and tell Gloria we all said hello.
I want to thank you and Elizabeth and all the folks at New Direction Family Law for having me on today. I really appreciate it.
Absolutely. It's been my pleasure. It's been our pleasure. It's always good to talk to you, have a good laugh. Tell Mike we said hello too. He's always a big ball of fun. So you guys stay well, keep doing the amazing work that you're doing for the community, and we'll see you next time.
Thank you.
Mm-hmm.